Benign prostatic hyperplasia, or BPH, is a condition affecting a large number of men and has a significant economic burden on the healthcare system. Initially, only surgery options were available, but today patients have the option for minimally invasive alternatives such as prostate artery embolization.
Prostate artery embolization, or PAE, it's an embolization procedure which is done by interventional radiologists through image guiding fluoroscopy. So basically the idea is to get a microcatheter inside the arteries that feed the prostate and then occlude all vessels going into the prostate, so do a selective embolization of the prostate arteries on both pelvic sides. The major advantage of prostate embolization is that it's a very well tolerated procedure.
So it's actually a fantastic procedure, made under outpatient procedure. 3 to 8 hours later, the patient can go home. Many patients, they just want this therapy. So it will be the future, I still believe.
The main challenges with PAE are based on the technique and the anatomy. The pelvis has around 15 different collateral arteries in each pelvic side, so it may get a little bit difficult to find 1 to 2 millimeter prostate arteries.
Many centers are starting new in PAE, but this procedure is technically challenging. Expert CT assists in clearly identifying prostate arteries and potential non-targeted embolization. It also helps to find optimal viewing projection for treatment.
If you're starting new in PAE, I'd say that expert CT is fundamental. So you probably need 2 expert CT acquisitions on each pelvic side. One to identify which is the artery going into the prostate, and the second acquisition once you're inside of the prostate artery to make sure you're in the right artery that feeds the whole prostate and you don't have collateral feeders to extraprostatic organs. So expert CT is the best tool to have if you're starting.
The convenient CT really is fantastic. We can see the arteries, we can see the anatomy. I think that is indispensable nowadays to have this tool. We need it.
During prostate artery embolization procedure, the 3D roadmap functionality is also useful as it assists with guide wire and catheter navigation through complex vessel structures by providing live fluoroscopy overlay on 3D angiography. By partnering with pioneers in this field like Professor Pesco, we at Philips aim to drive clinical evolution of innovative treatments for superior patient care. Innovation and you, Philips.